My name is Greis. I'm dermatologist at the University Hospital of Zurich, and I'm very happy to present you today our experience, 2 years of experience in teledermatology in the German-speaking countries. First of all, I would like to thank you, the International Society of Teledermatology, for letting me speaking here. It's a great honor, and I hope I can bring you some exciting numbers, experience from our countries. As mentioned, I'm a dermatologist at University Hospital Zurich, focused on dermatosurgery. That's where I'm coming from right now. But I'm also focused on telemedicine in our clinic. But I was also founder 2018 of the teledermatology startup Derma2Go, based in Zurich, Switzerland, nowadays also with an office in Munich. First of all, I would like you to show a slide about the market size in German-speaking countries. There is a publication by Professor Augustin 2018 showing that 25% of the adult population have an annual need for dermatological treatment. And out of these, 70% of these cases can be treated by teledermatology, so a potential online dermatology cases. And I think that's a huge market we are targeting nowadays. Also in 2018, based on these findings, with a group of different dermatologists, different clinics within Switzerland, I performed a survey, a study on the unmet need of dermatological patients regard to digital health services. We performed this survey on 840 dermatological patients, where 76% would like to use digital services as part of their medical consultation. One major need was digital prescriptions. I think this is what is already happening, not on a daily basis, but will be more and more pregnant in the will be more and more relevant within the next years. Electronic registration forms where patients can fill out before they see the dermatologist with the major necessary information, medical information. And the most wanted digital health service was making up an appointment with the dermatologist online. And I think this is something we already realize as doctors and offer as doctors through our websites a lot of times. Another survey made from the Swiss government about the needs of doctors, but also of not patients, but the general population regarding digital offers. And they asked 500 doctors overall, not only dermatologists, and 2,500 people about their needs. And the survey revealed that the digital offerings play a major role in the choice of a medical practice. So if you, as a doctor, if you offer, for example, online appointments or online consultations, this could be a reason why you're chosen by your patient. And interestingly, and I think this is what we doctors might not know, but interestingly, overall, the interest of the population in digital offerings was greater than the interest of the medical professionals. And the biggest interest, and as I mentioned, this is a survey performed on overall doctors, not only dermatologists, and the major interest was to send photos to a doctor within smartphones. So welcome to teledermatology. Teledermatological offers increased in German-speaking countries during the last 2 to 3 years. There are different providers, and for example, I'm sitting in Switzerland, as I mentioned, in Zurich. If you Google here for online Hautarzt Clinic, means in English online dermatologist clinic, you'll find a lot of offerings nowadays. So you see here 4 major Swiss clinics offering online consultations through their web pages. And this is how it looks like. We have these 4 clinics. University Hospital Zurich, where I'm sitting right now, we are offering to our patients online consultations, but also University Hospital Bern on the right upper side, University Hospital Basel with Professor Navarini, who is the head and who will also speak later on about telemedicine, especially telemedicine in psoriasis, and another major hospital, Triemli Hospital in Zurich. On the one hand side, because of increasing offers, but also increasing interest of patients, we saw a great increase of online requests, of teledermatological requests during the last 2 to 3 years. We started to collect numbers in 2018 with a minor increase to 2019. And then you see it's year by year. But we remember in the beginning of 2020, with Corona, we had a major increase in online requests due to increasing interest by dermatologists, but also by our patients. And I think this is a proof of concept the last 1.5 years. And we see right now that these numbers are still increasing. We are at a teledermatological congress, so I'm sure I don't need to explain the difference in between story and forward, so asynchronous teledermatology and live interaction, so video teledermatology. I was asking about 80 to 100 dermatologists in a live conference what kind of teledermatological services they would prefer. And out of these 80 to 100 dermatologists performed last year this study, more than 80% would or actually do prefer story and forward asynchronous teledermatology in comparison to live video interaction teledermatology, mostly because of the pictures. And I think this is a central part, and also the possibility to integrate it easier with capacities to integrate it easier in the daily practice. We got some opinions of our dermatologists, but I think it's even more important to understand what do our patients think if it comes to digital dermatology and digital or teledermatology. And this is a slide to actually figure out who is our target group. And I really like this graph down here showing the age from 0 to 100 in the horizontal and the number of cases in the vertical. And you see there are a lot of cases, maybe not everyone is aware of this, but a lot of cases in very young patients where mothers, fathers send in requests, parents send in requests for their children, decreasing by the teenager time, and then with early 20, middle 20 to 40, 50-year-old patients who are the major target group within teledermatology. And just to bring two examples on the left-hand side, maybe you've already seen this picture. It's not my picture, I put the source underneath. A digital native who is taking his selfie stick, his mobile phone to, in the end, take a picture of his back to probably show, maybe even through a video, his back, the skin, maybe moles to his dermatologist. So this is the one hand side how this could happen, but on the other hand side, and this is a picture from one of my patients, from one of my online patients, you have this elderly woman with an actinic keratosis on her back of the nose, but on this picture and also on one or two other pictures she sent in, there was no possibility to actually see the skin. What you could see, and I put here, I pointed out here, you could see this is a bathroom probably in Switzerland with this electricity plug you've probably seen before. To dive a little bit deeper into our patients, we not published yet, but did some studies on the numbers, the recent numbers. We took a cohort of 714 patients with an average age of 40 years, 0 to, in our case, 90 years old. We have patients from 0 to 100 overall, but in this cohort to 90 years old, and with a gender a little bit more in female, and that's actually very typical. We've always a little bit more female in our cohorts, in our teledermatology in comparison to males. If we screen for the diagnosis, we could figure out that most of the diagnoses sent online are facial dermatosis. 1/3 of all requests are acne, 15% rosacea, and eczema was 3% top 3. But, and I think this is very similar to what we see in person, we do see from very simple diseases to very severe sick patients, all diagnoses also online. Just to understand our patients a little bit better, we ask every patient, when did the problem start? And our numbers, same cohort still, showed that most of the patient, 2/3 of the patient, have the problem longer than 1 month. So have either chronic diseases or at least diseases that appear more than one time, and they suffer for, as I said, more than 1 month, or even 1/3 more than 1 year. Most of our patients do not have pre-existing diseases. More than 80% are healthy. And this is probably because of the cohort I showed before, because of the age. In between 20 to 40, 50 years, we have middle-aged patients without pre-existing diseases. And about half of the patients haven't performed any previous treatment. 53% in our cohort haven't tried any treatment before they actually contacted the dermatologist online. Every patient in our cohort, actually in general, who's using teledermatology, is asked about his satisfaction. Is the patient satisfied at day one? That's the day where he receives the diagnosis, he or she receives the diagnosis and the treatment plan by a dermatologist online, and after 21 days, this is on the right hand side, 21 days after receiving the diagnosis, so you already might have some success in treatment. In both surveys, we have a treatment satisfaction overall more than 83% with happy patients. And I think this is very interesting. If you see in brackets down here, you can increase the satisfaction to more than 90% if you instruct the dermatologists by very experienced dermatologists, online dermatologists, who know where patients, or actually how patients need to be treated online. So there needs to be some experience to actually know what also the differences in between personal and online dermatology. We asked, why are you happy? Why are you satisfied with teledermatology? And 91% said they trust in online consultation, and 92%, and I think this is also the major reason why patients use and in the end are satisfied with teledermatology, it's the quick response time. Within our cohort, we had an average response time of 4, maximum 8 hours, and we guarantee an answer within 24 hours by the dermatologist. This results in a high satisfaction, as I showed before, and more than 83% of patients who would actually use the tool for teledermatology again. A very central question I always or often get asked by dermatologists when I introduce a system to them is, how long does it actually take to answer an online request of a patient? And this is mostly asked by dermatologists out of economic reasons. So they want to understand if it's worth in the end, from a financial perspective, to integrate teledermatology in their clinics. And out of our cohort, we could show that an average patient was logging into the system, reading the information, in the end reveal a diagnosis and a treatment plan. It's about 8 to 9 minutes. But if you're, and we had a separate group, if you're more experienced in online dermatology, you can decrease this time to, in average, this is in average 5 minutes. There are requests that take less than 1 minute. We are working with text blocks here, but also some where you need to call the patient, and this takes time. And I made a first use case now from the economic side to understand from a major Swiss clinic if it's in the end financially interesting to offer teledermatology to patients, and I could show that there's a financially positive outcome also for the clinics and the doctors actually offering the teledermatology. To conclude our findings within this cohort, and I think this is nothing I need to say here at the Teledermatology World Congress, The question is not whether teledermatology will take place in dermatology, but how we as doctors, as health stakeholders, but also as patients, how we can shape teledermatology. And so far we can show that start and forward consultations, in this case by the application Dermat2Go, is highly beneficial with simultaneously high experienced satisfaction from the patient's side, but also from the doctor's side, and will be, and that's where I believe in, will be in the future a supplement to the existing routine care. So we will, for the future, we'll have hybrid models where teledermatology will be supplementary used to existing personal routine care. And I think, and that's what we're working on right now. It's very interesting to figure out which indications and also which patient groups are particularly suitable for these kind of teledermatological applications. And I think there needs to be performed more and further studies. If you want to read more about teledermatology in German-speaking countries, there are actually guidelines published by Professor Augustin about teledermatology in German-speaking countries. It's really interesting to read these guidelines, and I think a lot of these contents are also suitable for other countries within Europe, but also all over the world. So please, these are free, accessible. You can find them online. In the end, and I'm repeating myself here, we are all very excited about what's coming next, about digital dermatology, about teledermatology, but we really must think in the interest of our patients. We need to still and always keep in mind that compliance is a very important, a key topic, also if it comes to telemedicine, especially if it comes to telemedicine, to understand our patients, if they understand us, if they understand the diagnosis, if they will perform the treatment. And this is not as easy as we have in personal routine care so far. So this is something we have to take care of if we perform online consultations. Data security, a big topic if you especially look for a platform you're going to use for you and your patients. The liability, all the doctors I know in German-speaking countries who are performing online consultations, they asked their liability insurance beforehand, and we're working with hundreds of dermatologists, and all of their liability insurances in the end would cover the liability if something would happen online. And the last point, and that's still a point that needs to be solved in German-speaking countries, is the reimbursement of asynchronous telemedicine overall, especially also teledermatology. Most health insurances so far do not reimburse these kind of services, and this is what we need to tell our patients before we offer. But I think this is also where we as doctors, as dermatologists, need to push a little bit into this direction to get it in the end reimbursed by health insurances. With this slide, I want to thank you for listening. I want to be open for any questions. We have a discussion around later on, and I'm also very open for further questions or further comments if you want to contact me by email. Thank you very much, and I hope you enjoyed the conference and the upcoming talks. Thank you.